To diagnose addiction, mental health professionals use the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which provides specific criteria for substance use disorders. This is the standard guide used to determine whether someone's behavior has crossed the line from casual use or abuse into addiction. The DSM-5 identifies 11 criteria that are evaluated over a 12-month period. If someone meets a certain number of these criteria, they may be diagnosed with a substance use disorder. The more criteria met, the more severe the disorder. 1. Using larger amounts or over a longer time than intended. 2. Unsuccessful efforts to cut down or control use. 3. Spending a lot of time obtaining, using, or recovering from substance use. 4. Cravings or strong urges to use the substance. 5. Failing to fulfill major obligations due to substance use. 6. Continued use despite social or interpersonal problems caused by substance use. 7. Giving up or reducing important activities because of substance use. 8. Using in physically hazardous situations, e.g., driving under the influence. 9. Continued use despite knowing it's causing physical or psychological harm. 10. Tolerance, needing more of the substance to achieve the same effect. 11. Withdrawal symptoms when not using the substance. To receive a diagnosis: mild disorder, meeting 2 to 3 criteria; moderate disorder, meeting 4 to 5 criteria; severe disorder, meeting 6 or more criteria. These criteria provide a detailed picture of how addiction impacts daily life, relationships, and responsibilities. While it may be overwhelming, it helps identify patterns and guide professionals toward effective treatment plans. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our Mental Wellness Hub on the Happy app. Click the links in the description. While the terms physical dependence, addiction, and tolerance are often used interchangeably, they describe different aspects of substance use. Physical dependence. This occurs when your body adapts to a substance, causing withdrawal symptoms when you stop. Physical dependence doesn't always mean addiction. For example, many people who take prescription medications like painkillers develop a physical dependence but aren't necessarily addicted. Addiction. This is a broader term that includes both physical and psychological dependence. Addiction involves compulsive behavior where a person can't stop using the substance despite knowing the damage it causes. Tolerance. Tolerance happens when, over time, you need more of a substance to feel the same effects. This is common in many addictions as the brain becomes less sensitive to the substance's impact. Tolerance can lead to physical dependence and increase the risk of addiction, as the person starts using more and more to achieve the same result. Example: someone taking prescription painkillers after surgery might develop tolerance, needing more of the medication for relief, and physical dependence, experiencing withdrawal symptoms if they stop suddenly. However, if they begin taking the medication compulsively, even after the pain is gone, and it interferes with their life, it may cross the line into addiction. Understanding these differences is crucial because not everyone who is physically dependent on a substance is addicted. However, both tolerance and physical dependence can contribute to the development of addiction if left unmanaged. Catching addiction in its early stages is crucial for preventing more severe outcomes. There are several subtle warning signs that indicate a person may be heading toward addiction. 1. Increased tolerance. Needing more of the substance or engaging in the behavior more frequently to achieve the same effect. For example, a person may start drinking more alcohol than usual to feel the same buzz. 2. Preoccupation with the substance or behavior. Thinking about the next time you'll use or engage in the behavior even when you're not currently doing it. 3. Loss of control. Having trouble cutting back or stopping use even when you want to. People may promise themselves they'll only have one drink or limit themselves but fail to do so. 4. Isolation. pulling away from family and friends to hide their use or to spend more time engaging in the behavior or using the substance. 5. Changes in priorities, shifting focus away from activities, hobbies, or people that once mattered to them in favor of the addiction. Example: someone may initially use painkillers after an injury, but over time they start to use more than prescribed. They may think about the next dose constantly, lie to their doctor to get more, and begin withdrawing from social activities. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our Mental Wellness Hub on the Happy app. Click the links in the description. Finally, although this course is free for you, it was not free to get it to you. If I have helped you, all I ask is to think about supporting me with a small donation to my Patreon account or grabbing my Happiness Handbook on Amazon. The links are in the description. Your help allows me to continue creating these courses, reaching others, and spreading the joy in every language.